encourage you to become a little bit more involved with the show. And the next item is an interactive first.
Yep, never done this before. Via Skype, your sex problems will be answered with the help of Dr. Jo.mp4 and sex therapist Jo Hemmings. Welcome both.
Good morning.
Let's get straight on with Jess, and well done all of you for coming on and doing this today. It's a very brave thing to do, and we appreciate it. So let's hope we can help you out. Jess, what's the problem?
Hiya. When I have sex, it hurts me, and I bleed as well. And it runs in the family, and I've tried to get a smear, but with my age, I'm only 22. The doctors won't give me one. You know, I've been down lots of times, and they're just not interested.
Well, you do have a history in your family, don't you?
Yeah, I do.
So can you explain that?
Yeah, my mum and 3 of my aunties have had to have hysterectomies because they've had pre-cancer cells, but they had laser treatment for it, but it came back again, so they had to have hysterectomy. And then I have 2 cousins that also had laser treatment because they had the pre-cancer cells as well.
Okay.
So I think, I mean, the important thing is, Jess, it's great that you've actually that you've contacted us, because I think very often people get a bit confused about smears. So what we have is a screening in this country, and that does start, certainly in England, it starts at 25. Actually, in Wales and Scotland, it starts at 20. So it is confusing. But that's when you don't have any symptoms. That's for screening for abnormal cells that are pre-cancerous. You have symptoms, and that's really important. Anybody who has pain or bleeding ought to be seeing the doctor, and the doctor should be investigating. I'm very surprised that they haven't. Not because I think it's cancer, because, to be honest, cervical cancer doesn't really run in families, but actually because you need screening for other things as well. And in particular, if you're getting pain and some bleeding, then you ought to have some screening for chlamydia, because that's one of the things that can cause that. So there are a number of investigations to have. It's not that I think that's necessarily the case, but you ought to be tested for all of these sort of things. So don't ignore it.
If you have a doctor who is unwilling, then what do you do?
Well, then I think you can think about going to, for example, a family planning clinic or a sexual health clinic, where they're also very experienced at dealing with this sort of thing. And sometimes it's just, I'm sure, you know, I can see how anxious Jess is, and I think that, you know, sometimes it's just important to go back and say, look, I'm really worried about this. Or talk to the practice nurse, because often they'll also be very experienced.
I mean, on the more reassuring side, Jess, that actually sort of painful intercourse and bleeding afterwards can be quite common, and it may simply be to do with not being aroused enough. You might need to use a lubricant because actually the walls of the vagina can get quite dry, they can sort of bleed. It's quite commonplace, but if you have enough moisture, you may have some cervical erosion, but again, that's nothing to worry about. It is quite commonplace, but it is painful. Then to use as much lubrication to make it as comfortable for you as possible should help.
So that's the first. I mean, I would suggest that maybe the doctor would be your first port of call.
Get checked out,
go and get
and
that
obviously if you're all clear.
Absolutely.
Okay, thank you very much, Jess.
Good luck.
Thanks, Jess.
So we go on to Jenny now. Good morning, Jenny. Jenny's 25. Jenny, tell us what you want to talk about.
Good morning. I've recently had endometriosis removed last week. I'm currently off work all this week. Basically, for the last 12 years, I've just been suffering. It's been undiagnosed. I'm concerned because I want a normal sex life. I want a normal life, and I don't know what to do. It is painful during intercourse, and I just want that normal life, really, that everyone else has at my age.
Well, you're worried that this might affect your relationship, aren't you?
Your marriage, yeah.
Yeah, I've been married a year to a wonderful husband who's a complete and utter pain, who I love dearly.
Okay, what's the suggestion?
Well, I guess actually, I think probably Jo's going to be able to help out the most. From my point of view as a doctor, the only thing I'd say is, you know, endometriosis does cause discomfort when you're having sexual intercourse, and I suspect what's happened is obviously because of that, you've got a bit fearful about sex, and it's really important. It's wonderful you've got a sort of understanding partner who's going to help with that. But medically, all I can really recommend are the treatments for endometriosis, in the hope that by treating the endometriosis, sex will become more comfortable.
I think if you're used to that sort of habit of pain, what happens is your expectations are now that it will be painful. And so what you need to, it's a sort of fear cycle, which you need to break. And sometimes actually using something like a little bullet vibrator on your own, just sort of getting yourself used to the right pace, the fact that it will be a little uncomfortable at first, but the discomfort will go, and then you'll sort of, that fear will cease.
Is this the sort of thing that you're
Absolutely.
you're talking about?
They're just tiny, they're very gentle. And it's just to get you over that concern, which is causing you probably, again, pain because you're tensing up with anxiety. So to break that cycle, actually not having sex, perhaps for a week or two, and just getting used to your own body again and relaxing a bit more, getting your confidence
and also,
back.
yes, feeling good about yourself, because you say you feel detached and not sexy and frumpy and a failure. You're gorgeous.
You're gorgeous. It's all going on in your mind, you know that. But, you know, you've got to get through that for yourself and convince yourself that you're as lovely as ever. Your partner sounds brilliant, very supportive. You know, talk to him about it, share it with him.
Yeah. Come on, Jenny.
Oh, thank you.
Good luck. Good luck.
And Samantha. So Samantha is our next Skype caller, and had a baby 3 years ago, and lost your sex drive.
Completely.
So how bad is it? How is it worrying you?
It's, I just have no want to do it or go near it, or my poor partner suffers because of it.
Okay, so 3 years. I mean, a busy mum.
Yeah.
So and a relatively new baby, 3-year-old. That's going to take up a lot of time.
Absolutely, and I think it's something that we see very often, actually, after people have had a baby. And Samantha, it's something that you know, isn't unusual. Libido, sex drive does come and go, and I guess the important thing is to try and take some of the pressure off, because I think very often you get into this cycle of feeling that you should, then worrying about how your partner feels. And I just wonder, is it something you've talked to your partner about?
Yeah, I do. He's very understanding. He doesn't pressure anything, but he, you know, you can tell that he does mind, but he tries not to.
And you're also someone else who said that you're very unhappy with the way you look, and you don't want anyone else to have to look at you.
I mean, that's not this sort of post-baby slight body dysmorphia, if you like, is very common in women. I mean, our bodies do change, our shapes change, our pigmentation changes, our breasts change. We look different. We've become mothers. Again, you know, it's a natural process, and again, something to share with your partner, because I'm sure he finds you as gorgeous as ever.
Yeah.
And again, we do get obsessed with the fact, because we look different, our partners won't find us as attractive. And that has a knock-on effect on our libido. I suspect your libido is still there, but it's sort of buried under the fact you just do not feel confident about your own body any longer. Yeah. So again, I'm thinking things like making love by candlelight, very, very soft and forgiving lights, wearing a sort of silky robe or wrap, something that you don't feel that exposed, and it can be gentle, just to sort of lure yourself back into that sensation again, which I think has gone for you for now.
And then get your confidence built up, because you're getting married in August as well, aren't you?
Oh, sorry?
You're getting married in August as well, aren't you?
Yeah.
Yes. Well, you know, once again, you're absolutely lovely, and it's so easy to hate yourself from the inside and not see that you're actually lovely when people look at you.
And it's a sort of vicious cycle, really, because the problem is if your esteem goes, then you become more depressed, and of course libido goes with that as well. Yeah. So that's really important, and that's something, Samantha, that you should talk to your doctor about. If you do start feeling low, you know, we haven't had the time to go into it in detail now, but if you start feeling low and depressed, then it's really important to talk to the GP.
I mean, libido is very much connected with your own self-esteem levels.
Yes.
Yeah.
If they drop, your libido will inevitably go with it, and it's the way it is. Dr. Johnson's absolutely right. Got to have that, you know, that little inner boost you need to sort of get it back up there, because they work sort of in synchronisation. Really.
Well, I think if you hang on anyway, I mean, all our ladies here can hang on. If there's anything else you want to discuss beyond what we've just talked about, and also Samantha, maybe you do need a little bit of an extra chat.
Yeah.
And thank you all so much.
Good luck to you all as well.
The most important thing about all of these is that you know, had the guts to talk about it. Not just to either mates or doctors or whatever, but to talk to us as well.
Brilliant.
You'd have helped a lot of people who would be thinking the same thing.
Yeah.
You're not alone, not on your own.
Good luck to you all.
Thank you
very much.
Thank you very much.
Thank you as well.
Thank you.
Oh, you're welcome. Thank you.
If you are in need of some